We've got about 5 questions related to pharmacokinetics. First question. 72-year-old patient, weight 70 kg, requires IV loading dose of drug X. Bioavailability is 100%. Salt factor is 1. Calculate the loading dose. Now, I have given here the equation for the loading dose. But in some SPLE questions, you might not be given the equation of loading dose. So you need to memorize the equation of the loading dose. Okay? So the loading dose equation is Cp, the plasma concentration required, volume of distribution, salt factor times bioavailability. The plasma concentration I'm targeting here is 1.5 nanograms per ml. It's important to write the units, so that's why I'm writing the units. So plasma concentration, which I'm targeting, 1.5 nanograms per ml. Volume of distribution here is given. It's 5 liter per kg. Weight of the patient is 70. So volume of distribution would be 350 liters. So plug that volume of distribution in here. And for S and F, we don't need to write anything because bioavailability is 100%, so F would be 1. And salt factor is also 1. So we don't need to write anything here. 350 liters. So that's the equation we have got. Now, in loading dose equation also, Cp and volume of distribution needs to be in the same unit. Okay, but here 1.5 nanograms per ml and is 350 liters. So we need to convert this into per liter instead of per ml. Okay, so 1.5 nanograms per ml will be or there is another way we can do it. We can find out if 1 ml has 1.5 nanograms, then 1,000 mils, which it would be 1 liter, will be how many nanograms? So we can actually also write 1,500 nanograms per liter times 350. So the reason I calculated it as a per liter, so that liter will cancel out liter, and we will be left with 1,500 nanograms times 350. So that's about 525 nanograms. Okay. Let's erase this instead. Let's keep it simple. Okay, so 1.5 nanograms per ml, I converted into nanograms per liter. That's 1,500 nanograms per liter, so liter cancels out liter. So now I'm fine to go ahead. So 1,500 nanograms times 350 will give me 525,000 nanograms. But the answer needs to be in mcg. Okay, calculate the loading dose in mcg. So just convert 525,000 nanograms into mcg. That would be what? Going from so here are nanograms is a smaller unit. mcg is a bigger unit. So here I'm moving from a smaller unit to a bigger unit. The decimal will move towards left. So it was here, 1, 2, 3, it will come here. So it will be 525 mcg. The next question, a 70 kg man with AF. He requires oral loading dose of digoxin and target plasma concentration is 1.5 mcg per liter. Volume of distribution is 6 liters per kg. Salt factor is given, bioavailability is given, and we need to work out the loading dose. So again, loading dose equation is targeted plasma concentration times volume of distribution divided by sort factor by availability. Plasma concentration we are targeting is 1.5 mcg per liter. Volume of distribution is given here 6 liters per kg. So 6 times weight of the patient, 70. This becomes what? 420 liters. So plug this in the equation. So here I can cancel out liter with liter, so I'm okay to go ahead. This will become 0.7 times 1. What do we get? 15 times 420 divided by 0.7. 900. 900 watts. mcg, because here we are left with mcg. Important thing again in the loading dose equation is first of all you need to memorize the loading dose equation, so you need to know that. The other thing is when you're plugging the values of Cp and Vd, make sure that they are in the same unit. Usually volume of distribution is given in liters, right? And plasma concentration, targeted plasma concentration, whatever unit it's given in, make sure that you convert it to per liter. Okay, so that will match the volume distribution units. Next question. So these first 2 questions were related to the loading dose. The next 3 questions are a little bit different. A drug has been administered IV for a patient who has an infection. What percentage of the drug will remain in the body after 4 half-lives? It's a very easy calculation. We started with 100% of the dose, and after first half-life, it's reduced to 50%. After second half-life, it's reduced to 25%. After third half-life, it will be reduced to 12.5%. And after fourth half-life, it will be reduced to 6.25%. Okay, and 6.25% is the answer. It says what percentage of the drug will remain in the body after 4 half-lives. So that's 1 half-life, second half-life, third half-life, fourth half-life. Next question. A drug has a half-life of 5 hours. After how long do you expect the drug to be reduced to 6.25%? So again, very similar calculation. We start with 100%. So after first half-life, 100% is reduced to 50%. After second half-life, reduced to 25%. After third half-life, reduced to 12.5%. After fourth half-life, it's reduced to 6.25%. So that's what I'm targeting at. But it has taken 4 half-lives. Each half-life is 5 hours. So after 20 hours, 100% is reduced to 6.25%. Okay, because there are 4 half-lives. In this question, half-life was given, it's 5 hours. So 4 half-lives are 20 hours. The next question, a drug showing first-order elimination kinetics. First-order elimination kinetics. What is first-order elimination kinetics? The elimination rate is dependent on the drug concentration. So majority of the drugs follow first-order kinetics. And as opposed to that, there is zero-order kinetics. What is zero-order kinetics? Zero-order kinetics is where the drug elimination is independent of the concentration. Which drugs follow zero-order kinetics? Phenytoin, very good. Phenytoin and alcohol also. So when somebody drinks alcohol, that it keeps building up because elimination rate is not dependent on the concentration. So zero-order kinetics examples, phenytoin and alcohol. Okay, drug showing first-order elimination kinetics is a half-life of 5 hours. After IV injection of 100 milligrams, 75 milligram of the drug will be eliminated in what time? So let's start with 100 milligrams. After first half-life, 100 milligram will be reduced to 50. After second half-life, this 50 milligram will be reduced to 25 milligram. And after third half-life, this 25 milligram will be reduced to 12.5. But actually, I don't need to go ahead that far. By this point, 25 milligram is left. That means 75 milligram is gone, right? By this point. And that's what the question is asking. So after how many half-lives? 2 half-lives, and each half-life is 5 hours. Right? So the answer is 10 hours. So if you started with 100 milligram of that drug, after 10 hours, 75 milligrams will be eliminated, and you will be left with 25.